Hi, my name is Jessica Trimmer. Do you want to know how to save a life? In the case of someone not breathing, you will perform cardiac pulmonary resuscitation, which is also known as CPR. If you were walking one day and you saw somebody collapse, your instinct would be to run over and help them. The first thing you have to do in order to help them is to check that the scene is safe. If the scene is not safe, you could potentially be endangering more people or yourself. Once you have checked that the scene is safe, you can approach the person and you can tap their shoulder and ask, "Are you okay?" If they are not breathing, you will not get a response. Once you realize that they are not breathing, you will call 911 and send to get an AED, which is an automated external defibrillator. If there is someone nearby, a bystander, you can send them to get the AED or send them to call 911 to get help. Once you have called for 911, you will open the airway. In order to open the airway, you must tilt their head back and you want to lift their chin up. If you have not seen the accident, you might not know how they have fallen, so you don't want to move their back. You want to keep their back on the ground, try not to move it that much, just focus on the head, tilting it back and lifting the chin up. That opens the airway. Once you have done that, you will reach down and listen for breathing. You want to listen for about 10 seconds, but no more. Can you listen? You want to listen very carefully as the breathing might not be too loud. Once you have listened and you realize that they are not breathing, you will begin CPR. You start off by doing 30 compressions and then 2 rescue breaths. In order to do the compressions, you want to put one palm on the middle of the chest. You take the other palm, interlock the fingers, and put them on the middle of the chest. And you're going to push down like this with this formation. What you want to make sure when you're doing this is to not come at an angle. If the patient is here and I'm coming this way at an angle, I'm going to be not going directly on the heart, I'm going to be coming at an angle, the chest bone. So you want to make sure you are above them and push down as hard as you can. Use your body weight. You're going to push hard. There are some times where you may hear ribs break. That's okay. Keep going. You want to go about 2 inches deep. Kind of have to just go an eye by that, but you want to push hard. You're trying to get 100 compressions per minute. Once you have done 30 compressions, you're going to go to your rescue breath. With the rescue breath, you do 2. Once again, you want to make sure the head is tilted, and you want to lift the chin up. When you do it, you want to pinch the nose, and you take your mouth and cover the other person's mouth. You want to make sure it's sealed tight, so all your air goes into there. You want to blow in, and you want to make sure you blow in and you look in the direction of their chest, because you want to look to see if the chest is rising, because you want to make sure it rises when you're blowing in. So you do 2 of those. Once you do that, you make sure it rises. If it doesn't rise, retry it again by retilting your head again. If it doesn't work the second time, the person may be choking, which you will go into another rescue technique. You will keep doing that for as long as it takes until help comes, until the AED arrives, or until you see some signs of life. That works for a child or an adult. If you are doing this on an infant, you will do most things the same way, but instead of asking, "Are you okay?" because they do not know how to respond, you will hit their foot, and if they move, then it's some sort of reaction. You do the same thing where you will do 2 breaths and 30 compressions, but this time you want to do breaths first. You just do 2 breaths over the mouth and the nose. With an adult, you just cover the mouth. With an infant, you cover the nose and the mouth. Want to make sure it's just sealed tight, just like you would in an adult. Give 2 breaths. See if the chest rises. Then you want to go into 30 compressions, but instead of doing the palm technique that you would use on an adult, you're just going to use 2 fingers right on the chest. And you want to go about 1.5 inches deep instead of the 2 inches deep. You do this until you see signs of life. If an AED becomes available to you, you will attach the pads that will go onto the human into the AED. The 2 pads that you have, one goes on the top right chest and one goes a little under the left side, so not directly over your heart. Once you attach those, you turn on the AED. The AED analyzes the heartbeat and the rhythm, and if it realizes that there is not a rhythm, then it will shock the patient in order to get the rhythm to keep going. So once you've turned it on, attach the pads, and you listen to the AED, it'll tell you analyzing patient. You wait a bit, and then it'll either say no shock advised or shock advised. If there's no shock advised, you continue CPR. Continue exactly what you're doing. Keep the pads on because it's going to keep checking, but you just continue CPR. If it says shock advised, you will make sure that everyone is clear. Make sure yourself is clear from the patient. Everyone around you is clear. You will hit the shock button. It will shock the patient. Right after it shocks it, you continue CPR again for about 2 minutes. After the 2 minutes, the AED will come on again, either saying no shock advised or shock advised. You continue this until you get help, and that is how you perform CPR. Thank you.